Hello, and welcome to Talk About It Tuesday. I'm your host, Keith Taylor. Today, I have my colleagues here. In lieu of Black History Month, we'll be discussing health in the Black community. I have...
Hi, I'm Nakai Barretto. I am an RMA at Stay Well Health, Chase.
And I have...
Hi, I'm Latira Massey, and I'm a family support provider at Stay Well Health.
So, to start the conversation off, let's discuss the illnesses that we had to deal with growing up in our households. So we start?
So in my family, being of both descents, African American, Hispanic, Vicks cured everything. So you had a cold, Vicks. You had high blood pressure, Vicks. You had, sugar, Vicks. I'm just kidding. But, it's a lot of home remedies that we use as a child growing up in my family. We just kind of reared away from the doctors a little bit, unless we were really, really sick, like in dire need of a physician.
Right. And what about your household?
Well, in my household, we pretty much went to regular scheduled doctor appointments to get your vaccinations or, to get those cards updated for school. Other than that, we use regular home remedies, which mostly consist of chicken noodle soup, ginger ale, and the famous go take a nap. You'll be fine.
Let's go take a nap. Well, in my household, it was a little different. I don't really recall ever really going to the hospital unless I was really, really sick. So that means like if we had, I remember having the chicken pox so bad that I couldn't move. I had it all over my body, but they waited until I got that way before they took me to the hospital. Prior to that, it was spraying away. My daddy was a minister, my mom was a missionary, so it was always pray, 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 pray. Oh, and anointing oil. Annoyed me, but I still had those symptoms.
Yeah. We were still sick, but we made it.
Yes, we made it, yes. And what are some other things the Black population go through when it comes to illnesses?
So the number one thing I can actually think of is the silent killer, hypertension. I know a lot of people, they don't think that having hypertension is something to be of concern. But it is, because you never know. Those who eat a lot of greasy foods, salty foods, we all like our seasoning, but sometimes it's just not good for us. And the salt content of chips, foods, different foods that are processed, a lot of salt in them. People don't understand that.
That's true.
Right,
Yeah.
that is true. I actually myself suffered with hypertension. I was diagnosed with it when I was around 23. I had a minor stroke when I was 21, and I had the symptoms and didn't pay any attention to it, and it actually was from stress. Stress is very serious. Not enough of us take it seriously,
Right.
and we don't follow up when we're not feeling well. So it can be very dangerous.
We sure can.
Like you were saying, that you ignored the symptoms, headache, fatigue, dry mouth, those type of things. They are the cues to say, hey, something is going wrong.
And we have to pay attention to them, yes.
Yeah, that's true. Yeah, my mother had high blood pressure too, and diabetes. What else is some things that our population go through?
Diabetes.
Yes.
Number one.
Very common.
Lose all types of body parts, fingers, arms,
Yes.
legs.
My granddad.
And it's not a game. You can have a stroke from
Yes.
having high diabetes. And it's I know as myself, my husband, he passed away at the age of 32
Sorry to hear that.
from those conditions, hypertension and diabetes. And just it's like, okay, I'll take care of it with medication, but medication is not the only thing that you need. You need diet, exercise, and consistency.
And staying away from stress.
Yeah, that too.
My daughter was diagnosed with diabetes, and she's young. She's only 23, but she's overweight. And a lot of times they don't think that it could catch up with you. And gratefully, she's in the first stages, so she could just take a pill now and change her diet. But that's very hard, especially in the Black community. We eat what we can afford most of the
Right.
time.
Yes.
So
that's
when
true.
you have young people wanting to change their diets from
Mhm.
quick fast food, microwave food to fruits and vegetables, actually meal prepping and stuff, it's kind of hard.
It is hard.
It's very hard, and a lot of these fast food companies, corporations, they market the healthy foods higher than the unhealthy foods.
Ain't that the truth? And then
Yes.
yeah.
So you automatically you're gonna go for the cheaper thing because you're trying
Mhm.
to, realize your pockets and
Make ends meet.
Exactly.
make ends meet, and
Yes.
they're like, okay, well, we got them.
Yes.
Yeah.
And these high blood pressure and diabetes, is this a hereditary type of illness as well?
Yes and no,
Okay.
because the family, they do not eat well.
Mhm.
Rice, beans, collard greens.
Yes.
That's the way to go.
making me
And both the
hungry.
African American, on both the African American and Hispanic community, and they don't understand portion control. A lot of our
No.
family members do
No.
not. Friends, family, gotta have portion control.
Yeah.
And we're really teaching the parents that as they well now with the home base to do it from a small age.
Oh.
Because if you don't start early enough teaching about the right portion size and good food choices, you're bound to just go straight for the junk food.
That's true.
I know with my grandson, he's only 14 months, and I teach him
Mhm.
because I know it's a family history. So let's start out early.
Yes.
Instead of those French fries, let's have apples.
Yeah.
Okay,
Instead of that soda, let's have water.
Yeah.
So I teach him right off the bat.
Okay. And what are some other things that our culture struggle with?
Well, mental health.
A big
Mental
one.
health is a
That's the
big
major as well as
one.
the
A
others, yeah.
lot of African Americans, we believe if we pray it away, it'll go away.
Yeah.
Yes.
They
Common.
do not believe in therapists. They do not believe in
No.
medications.
They should
They're
laugh
just
at
saying-
you if you went to the therapist.
Yes.
Yes.
Oh, you all
True.
right. You're just going
Mhm.
through a phase.
That's true.
You can't think of it as a phase when you're thinking about your mental health.
Exactly.
Right, or related to another ethnicity. A lot of times they say that's for this ethnicity.
Correct.
That's not.
That's
That's
what I
us.
was raised in. Yeah,
Correct.
we don't do
Yeah.
that. We go to church. We pray it away.
Exactly.
You pray it away.
And
but
it's a
Yeah.
silent one.
It
Mental health is really silent,
Yeah.
and it causes our community to self-medicate.
Mhm.
We find
Exactly.
other things
Other
to do to cope,
Mhm.
and
Right.
they're normally negative for our health.
Exactly.
Correct.
Especially if you're trying to pray something away and it's not happening, so that is going to affect your mental health. You know,
Yes.
what, is something wrong with me, God, that you're not hearing me?
Yes.
You know what I mean? So, yeah, so that causes more. So there should be a balance in that. I remember before my mother passed from high blood pressure and diabetes and a stroke, that
Wow.
it was years that she would not take her medicine faithfully. And then when I had came home and was seeing all this medication she was taking, I was like, this is crazy. I mean, she was taking more medication than I was taking, And I was like, okay, well,
Wow.
this is just too much. So I had to go find a doctor that was more easier into home remedies and
Yes.
some things that just cut off some of those pills she was taking, because those pills are the side effects of those pills.
correct.
Yes, and taking your medicine consistently at the
Yes.
same time
Yes.
every day really
Yes.
does matter.
Exactly.
And for our community, we have problems staying consistent with that
Oh,
type of
we are the
behaviors.
most reactive.
A lot of times inconsistent.
It's called quick cure. If
Yeah.
I take
Yes.
one,
Or-
I'm
It's
cured.
gonna go away.
Yes,
that's
yes.
the mentality. That's the frame of mind
that we have to break
Correct.
and
And
break that
also
curse. Yeah.
the guinea pig. I hear that
Yes.
a lot within my community. They're treating us as guinea pigs. I'm not
Yes.
going to take this. I'm not going to take that. Without the full knowledge that
Exactly.
it is it takes some time to figure out what will work for you when it comes to mental health
Exactly.
and mental health medications.
Right.
And it's not you being a guinea pig.
It's right.
It's just figuring out what works for you.
And that doesn't mean that you always have to be medicated either.
Correct.
Like
Correct.
sometimes a conversation can get you through
Yeah,
those traumatic,
talking to
traumatic
somebody you don't
situations.
know.
Right, someone that you don't know. Yes.
Sometimes it's talking with someone that you don't know, but it's just also having an ear to listen to.
Yes.
Because a lot of the, like I said, they're like, oh, you'll be all right, it's a phase. Parents, they do that.
Yes.
But you gotta listen.
Yes.
Family members, they don't listen to their children a lot of times. Old school.
Yes.
You got to
There'll
be
be-
strong. You have to be
You
strong.
have to be strong. You gotta be
Be
strong-willed to make
Yeah.
it through this world. You be okay, but everyone don't.
Yes.
They don't have that mentality.
And we have to teach. And I also teach the young Black community that I serve that we got to do active listening. It's not just about listening. Because most Black people that I associate with, they listen to respond. They don't
Right,
listen,
they don't
to hear.
listen to hear.
Exactly.
And
And
until
learn.
we listen to hear, we're not hearing anything.
That's true. Yeah. And is there anything else that we struggle with?
Well, just getting the medications. A lot of medications. These pharmaceuticals companies, they're a little outrageous at times. I just got a medication for myself, and I looked up the medication just to get a little history background because that's what I do before I take anything.
Mm-hmm.
Right.
And I'm like, how much does medication cost? $750. That's insane. What if someone didn't have insurance?
Yes.
Right.
Yes.
How are they going to afford these things?
Yes.
There
And
has to be alternatives.
It
It
definitely
has
has
to
to be
be.
alternatives. That's so true. So, what about sexuality when it comes to our population? Our community?
Well, I know growing up for me, it was mostly taboo to talk about anything other than marriage
Oh, yes.
and, you know, a husband and a wife.
Yes.
And it didn't happen at young ages.
Mhm.
You know, you were well over an adult. And as time went on, in the community that I resided in, I saw more and more teenagers being pregnant.
Oh, yeah.
And I saw more and more lesbians and, you know, gay males. And it was like shunned. It was
Oh,
really
yes.
like a taboo. They became violent at times towards those people. And that's what
That's
they
true.
called them, those people. To me,
Right.
we're all people.
Mhm.
But, you know, you were not welcomed. Let's say
Right.
that easily.
Yes. Not as easy as the other cultures.
Right,
Yes.
exactly.
It was very hard for the cultures.
And
Yes.
in my opinion, I call it the Adam and Eve syndrome.
Oh, yes.
Because I myself, I got married young. I was married at 19.
Okay.
The first thing everyone thought, oh, is she pregnant?
Yes, that's
Mhm.
it.
You know, my parents instilled in me, you know, if you want to take that leap, have stability, have a commitment. So that's what me and my husband chose at the time, to get married. Because we loved each other, not because someone was on the way, but
Right.
because of that. But that's the frame of mind a lot of people have. Oh, she must be pregnant. That's what that's why that's going on.
Right. That's true.
Or if you decide to not marry a male or be with a female, if you're a female being with a female, it's like, wow, oh, that's auntie. That's play auntie.
Oh,
Mhm.
yeah.
So
Oh, yeah, play auntie.
you gotta play
Yeah.
aunties,
Or
you
a
gotta play
phase.
uncles or a phase.
Yes. Or God will bring you through it.
Mhm.
Right.
So it's
Yes.
a lot of misinformation about sexuality with the younger children.
Yeah.
A lot of people shun me for speaking with my child about sexuality early. I'm like, listen, I'm telling you off the bat,
Oh, I know that's right.
this
Yeah.
is going on. This is your product. You have a reaction to an action.
Mhm.
Right.
So, and a lot of they don't want to talk about this.
Yes.
They just want to leave it be.
Yeah, and with that, then we find people that are they don't want to get tested for HIV, any other STDs. We find that the down low population, they're afraid to know their status because of something that they were taught not to do.
Yes.
You know, and then because it's in them to do it, then they want to not go get tested because of the shame and the
Guilt.
fear of the guilt and all that things like that.
Yeah.
So those are just 4 things that our population can most important that go through. You know.
Yes.
So with that, I would like to say that we all need to learn more about our sexual health, our health in general, learn more about medications, learn more about what it is that's going to make us feel better and proactive and not reactive to things. So I want you to take the time to take care of yourself, your mental, your physical. And I want to thank my colleagues for joining me today. And join us next week when we'll be discussing children's dental health. Until then, stay well.